Hello. Today we are going to be talking about Chapter 19 in the book, Get Your Michigan Driver's License Back, that I co-authored with attorney Matthew Zick. Today's chapter concerns the Michigan alcohol screening test and why it is still an excellent instrument. I'll go through the 24 questions on the Michigan Substance Abuse Screening Test, and as I do, I'll explain to you why they're important and why I ask them and what we're trying to do with this test. Usually before I administer this test, I tell people it's important to let the hearing officer know two things. One, that you know that alcohol and drugs are a problem and that you cannot use in moderation or any quantity of substances without posing a risk to yourself and to others on the road. The assumption is that if you have 2 or more DUIs or driving under the influence of a drug, that you've probably driven many times before and not been caught. I think generally speaking that's probably a true assumption, but so in that case it is very difficult, in fact impossible in most cases, to make the case that I'm okay with a couple of beers. It's just when I drink more than that that I have a problem. If you tell the hearing officer that you think you can drink in any quantity, you're not going to be awarded a license. Plus the law says that you have to be free of any abuse of alcohol or other substances for at least a year before you're even eligible. So to make the case that you're a social drinker now, or that you're using substances you shouldn't be using in a moderate way, is not going to usually turn out to be a winning strategy. The first question on the Michigan Substance Abuse Screening Test is, do you feel that you were a normal substance user? That means a normal user of alcohol or other substances such as marijuana or prescription drugs. They're going to look at things like whether or not you were driving without a license, and using a prescription without a prescription, or using a prescription drug without a prescription, is another problem. So don't try to make that argument. You have to convince the hearing officer of two things. That one, that you know that substances are a problem, you cannot use them in moderation, and two, that you're doing whatever you need to do to remain substance free. So that the proper answer to that question is no, because you're not talking to me if you're not abusing substances. Have you ever awakened in the morning after some drinking or drug use the night before and found that you cannot remember part of the evening? That's called a blackout. The autonomic nervous system is shutting down in part, and the memory part of your brain is failing to record. If you've had a blackout, that means that you've drank a significant amount. You drank enough to where part of your brain is not functioning and you have no recollection of what happened for a period of time. 3, did your family or friends ever worry or complain about your drinking? It's hard for me to believe that you've got 2 or 3 DUIs and your mother never said, you know, I really wish you wouldn't do that. I worry about you. How are you going to get to work now? Who's going to feed your children? These are realistic concerns. To say that it doesn't affect anybody but you is an indication of denial. 4, could you always stop drinking without a struggle after 1 or 2 drinks? Or could you always stop using a substance once you started? What's crucial about this is that if you say yes to this question, you're really saying I can control my drinking or my substance use. And again, if you could control it and you could use good judgment when you were drinking or taking whatever it is that you're taking, we're not having this conversation. If you go into a bar to have 2 drinks and you wind up having 8 and driving home drunk and get arrested, then if you're not at the point where the drink takes the man, you are certainly at the point where the drink takes the drink. And you have to own that. If you don't own the problem, you don't own a solution. If you are drinking before noon, then drinking is an important part of your life. You don't have to be drinking necessarily to have some hair of the dog that bit you. But if you start earlier in the day, that's an indication that this is a very important part of your life, maybe a central part of your life. And many alcoholics never they get to the point where they're not drinking to get drunk, but they just keep a blood alcohol level all day long. So they may not even appear drunk to others, but they have to have that minimal blood alcohol level in order to function. Have you ever been told you had liver trouble or other medical consequences of substance abuse? That's an indication of a more advanced problem. Have you ever had severe shaking, craving, or serious withdrawal symptoms after heavy drinking or drug use? Again, those are symptoms really of a physical addiction if you have shakes or cravings. And when you reach the point where you have physical addiction, you've been psychologically addicted for a long time, and it's important to realize that. Friends or relatives all think that you were a normal drinker or substance user. The family members are usually aware of a problem before anything bad happens, anything that would draw attention to your problem outside of the home. Kids sometimes tell me that when their alcoholic father was home, he still wasn't home because he was lost in his beer and his television or whatever it was that he was doing. 7. Were you always able to stop drinking when you wanted to, or using other substances when you wanted to? This is another issue of control. If you could always stop, then why didn't you stop before the 15th drink? Maybe you should have stopped at 2 or 3. It's really hard to make an argument that you're owning the problem when you drink enough to blow a high blood alcohol level and get pulled over by the police on more than one occasion. Have you ever gotten into a fight when drinking? Again, some people do, some people don't. But if you're violent when you're drinking, again, that's a good indication that you have a problem, or if you're violent when using other substances. Has drinking ever created problems between you and your family or friends? It's easy to see how drinking could create a problem if it makes you aggressive, causes arguments with your significant other, causes domestic violence, which are quite common among people that have substance-related problems. However, other drugs, it may not be as readily apparent that they're causing problems. Marijuana, for example, may not make people violent, but again, anything that you use that removes you from reality is going to have an effect on your interaction with other people, and it's also an example that you set for your children. So to say that your substance abuse is not affecting others is in most cases a delusion. Have your friends or any family members ever gone to anyone for help about your substance abuse? And that would mean professional help, or if they even went to a treatment center to support you, or went to an Al-Anon program, anything, gone to see a pastor about it, anything where someone recognized that your substance use was a problem for them. 12, have you ever lost a job or been suspended from school because of your substance use? You couldn't get up in the morning and go to work and you were calling off. So they didn't say, well, you were drunk on the job, but they just didn't like your attendance record. Attendance is one of the first signs of a problem on the job where your alcohol's or your drugs are interfering with your work. And it's probably the thing that is most likely to get you fired. Have you ever gotten into trouble at work or school because of your substance use? A lot of unions will keep employees employed even though they may have had alcohol-related problems. And so just the fact that you haven't been fired doesn't mean that your substance abuse is not interfering with your work. Have you ever lost friends because of drinking or drug use? Birds of a feather flock together. You may not have lost friends specifically because of drinking or drug use, but you may only associate with people who drink or do drugs. It's a very common scenario. One of the reasons why AA is effective, because a lot of times when people sober up, they don't have any sober friends. Have you ever neglected your obligations, your family, your work, or your school work because you were using substances? People will often tell me no, but it's hard to believe that you can drink or use drugs fairly heavily without neglecting something or someone. Using other substances, that's time that you're not giving to your work, or maybe time when you're not as productive as at work as you can be. Have you ever gone to anyone for professional help about your substance use? Most people who come into my office have had some kind of professional therapy. Have you ever been to a hospital emergency room because of your drinking or drug use? This doesn't mean that you drank so much that you passed out, or you overdosed on heroin and you had to be rushed to the emergency room. This could be simply the fact that you had an accident that you wouldn't have had if you weren't under the influence of alcohol, and as a result of that accident you were taken to the ER for treatment. Have you ever been a patient in a psychiatric unit where drinking or drug use was part of the problem? Many people are misdiagnosed as being manic depressive or some other disorder, when in fact the primary root of their problem is substance abuse. Have you ever been to a mental health clinic or gone to see a doctor, social worker, counselor, or clergyman for help with an emotional problem in which substance abuse played a part? The root cause often for this therapy is substance abuse, and if that is the case with you, you need to be honest about it. Again, you need to be owning the problem. So if these things apply to you, you don't want to argue with whether or not it's a problem. You want to own the problem, because if you don't own the problem, you don't own a solution. Have you ever been arrested, other than for drinking and driving, for other substance-related behaviors, such as minor possession of marijuana, and drunken disorderly? I find very often that people will lie to me about this. The hearing officer has both your criminal record and your traffic record in front of him, so he knows every time you've been on paper. If you deny it to me and you go to the hearing, you are definitely going to be denied. You may not think this is important, you may not think they have any right to know about this. However, substance abusers typically have more problems than just drinking and driving. They're very likely to have minor possession of alcohol, possession of marijuana, or other drugs. Lastly, have you ever been arrested for drunk driving or driving after drinking or using drugs? Of course, if you're seeing me for a substance use evaluation for the administrative hearing section of the Secretary of State, then obviously you have at least 2 of these. You may have 5. Sometimes people worry about this, and maybe one of the reasons that they deny how many they have is they're worried that the more they put down, the worse they're going to look. This is not the case. The hearing officers don't care how bad you were, how big a problem you had. All they care is, have you turned the corner? And we make that case for you. But we can't make the case for you if you're not telling the truth about how serious your problem was. Another question, number 2, is how much do you drink in a day or an evening? And if you drink, have built a tolerance to alcohol or drugs, let's say that you can drink a pint in a day or an evening. You may only do that twice a week, but it shows that you have a significant tolerance, which is an indication of that you have a growing physical dependency on the substance. You no longer can get the effect that you want with a little bit. You have to have more and more and more, and that's a quality that's common to addiction. And then I also indicate that what these 2 questions mean. The frequency of use, is it habitual, and the amount of use, is there an increase in tolerance? And I also ask the question, have you ever used other drugs? Sometimes people will say no to this if they haven't used marijuana since high school. However, if you go into the hearing and you said no to me, and you say yes to the hearing officer, I used when I was in high school, it doesn't matter that it was 20 years ago. You're going to be denied as not being credible. This is a good opportunity for you to really embrace the problem, because if you go in there with any trace of denial, you're going to be denied. Thank you.